All right, good morning, everyone. First of all, I want to thank you so much for taking time to work and volunteer with the SMP programs. It is a federal program that we couldn't be successful without you guys, and we appreciate all that you are doing to help us reach our fellow Tennesseans that have Medicare. And today we're going to go through how you compare Medicare drug plans and also Medicare Advantage plans for those that you will be counseling. The first thing is you always want to make sure that you are on the official government site for Medicare, which is www.Medicare.gov. If you happen to just enter drug plans or Advantage plans, you are going to see companies that have paid more to be the first on the list, and you'll always want to scroll down and make sure that you are at the official website. So as you can see, there's lots of information on this website that I hope that you will spend some time later on just to get familiar with the type of information that is available to you as you're counseling folks. But today we're going to focus on drug and Medicare Advantage plan comparisons. So keep in mind that Advantage plans are also called Part C as in cat, and they're also called health plans, which makes it so confusing for folks. But as long as you know the three different ways to talk about them, then you will know. So if you'll follow me here to find health and drug plans and click on that green box, that will take you to the Medicare PlanFinder section of this website. Today we're going to use a general search where we only need a zip code. And if you have a Medicare beneficiary that has with them their Medicare card that has their Medicare number on it, or they know it, and they know their effective date for their Part A as an apple and their date of birth, you can actually do a personalized search. And typically, if you can, that is the preferred search, because I'll share with you once we get in there the type of information you would glean from doing the personalized search. But today, for learning purposes, we're going to use a general search. So I'm going to type in a zip code. And select Find Plan. So it's going to give you, for step 1 of 4, it's going to give you some questions. And I'm just going to say that I don't have Medicare coverage yet, and I don't get any extra help, and I do want to add drugs today, because you could be talking with someone that is going to be new to Medicare, and those would be the correct questions. Once you answer the questions according to the beneficiary you're counseling, you're going to click on Continue to Plan Results. One thing I do want to point out, that if the zip code covers multiple counties, you're going to need to know which county in which your beneficiary's residence is in for this to work properly. So that will be an additional information. So I mentioned you could do a personalized search, and if you're able to do that, this box right here in the upper right-hand corner under My Current Profile is instrumental in helping you guys counsel when you're talking with your beneficiaries. It'll give you their current coverage. So we're assuming today that the person is going to be aging into Medicare today. But if they were already in Medicare and already enrolled in an Advantage plan or a drug plan, it would actually tell you which plan they were in. It would also give you an effective date, so you could know if they've been in that plan for years or if they're new to to the plan within the year. And then it would also tell you if they are getting any subsidy. And what we mean by subsidy is the extra help through Social Security or the Medicare Savings Program through Medicaid through TennCare, which you guys will be learning about later on today. So that little current profile box is instrumental in helping you with your counseling for Advantage plans and drug plans. So in this step, we are going to enter some medications, and I've just selected some common medications that typically our older adults take. And the good thing about this system is that it will automatically pop up the typical milligrams, and then you can enter the quantity and the frequency that your beneficiary would like to have the drugs filled. So with this, we can just go ahead and say, sure, this Medicare beneficiary is taking lisinopril tablet, 10 milligrams a day. They take it once a day. You can even change it. Let's say they take it twice a day, so you can enter 60 there. And you can increase it as much as they actually take that particular medication. You can also check with them to see if they want to fill the script every month, 2 months, 3 months, or sometimes in case of ointments or nasal sprays that are allergy related and they only get that tube or spray once a year, you can actually put it in that they only get it every 12 months, because it's very important that you try to get as close to how they fill their prescriptions to get the best estimate on the drug plan. You can also select retail or mail order. We've got a lot of folks that enjoy mail order, and today we're going to keep it with retail. So we're going to add the lisinopril. And once we do that, here is some valuable information. So you'll want to document the drug list ID for the Medicare beneficiary. I am old school, so I still have a paper copy of my client contact, and I write that in my notes. And then the password date, you can change that, but I usually now just keep it with the date that I'm actually running the plan comparison. So you write down the drug list ID and the password date. And the good thing about that is you counsel them for open enrollment this year. They come back to you next year, and all you have to do is go into the system and enter the drug list and the password, and the medications that you entered will pop up, and you can make changes. And I'll show you how you can make changes in just a moment. So let's go ahead and put, if you can't spell a word correctly like I did, then it will actually give you a list of medicines that are close to what you think you're doing. And a lot of times these drug names are difficult to understand what the beneficiary is telling you, and then to spell them is ridiculous. So I did mean a Novolog. It only gives me one option, and we're going to stick with the option that it's giving us for today. And I want to add Synthroid. Whoops. There it goes. Because that's another common medication that our beneficiaries are taking. And when there is a generic option, Medicare is encouraging folks to use generics because they are lower cost to produce and they're lower cost for them and the consumer, the beneficiary. But I'm going to show you the first run through. We're going to keep it as a brand name, and we'll come back and change it after we do the first run. So these are the medications that we're going to add for this beneficiary, and we're going to say that this drug list is complete. Another great option for the PlanFinder tool is that you can search for pharmacies and see if a pharmacy actually offers a lower cost. So pharmacies now are in and out of network with Advantage plans and drug plans, and we are seeing some significant cost savings when we do compare pharmacies. So with this particular zip code, there are 11 pharmacies within a half a mile. We can expand it up to 5 miles, and it will add all the pharmacies that are participating. So you can see that there are multiple pages of pharmacy options for this particular person. You can compare up to 2 pharmacies at a time. So what I would like to do just for training purposes is to select CVS, and let's select another common one. We have a lot of folks in the Knoxville area that like Food City. So I'm going to select those 2 and continue to plan results. So when you get to step 4, you can actually refine your plan results, and you can determine whether or not you want to run prescription drug plans only, or you can also include Medicare health plans, which are the Advantage plans. And it does give you an option for Medicare Advantage plans without drug coverage. Please keep in mind that there are very limited reasons that a Medicare beneficiary would be eligible to have a Medicare Advantage plan without drug coverage. And I believe that you all have gone over that yesterday. So today I'm going to select, I want to compare the drug plans because this person is new to Medicare and they're not quite sure whether they're going to select original Medicare with a supplement or if they are going to choose a Medicare Advantage plan. The other piece of information that's great to kind of be aware of is for this particular zip code, it tells us that there are 25 standalone drug plans available, and there are 15 Medicare Advantage plans available. So they do have quite a bit of opportunity for selection in this particular zip code. So at this point, we come to our plan results. And before we go any further, I want to show you this bar selection here right under the blue boxes. So let's say you're going along and you've already come to this screen, your plan results, and your beneficiary says, oh my goodness, I forgot to tell you that I'm taking XYZ medication. You can go back and click on Enter Your Drugs. And it will take you right back to the same person that you were in with your drugs, and then you can type in the new medication. It will automatically populate. Your list will now have 4 drugs, and then you can select My Drug List is Complete, and it'll take you forward to the next step. It does remember which pharmacies you selected until you change them yourself, so that's really good. And if you came back next year, those pharmacies would be listed as well. So we're not going to change pharmacies, and we are going to continue to our plan results. It did keep our selections for looking at drug plans and Advantage plans, so I'm going to continue to plan results. So with the plan results, there are going to be some symbols located within the plans. Most of them make sense. D for dental coverage, V for vision coverage, N for nationwide, and hearing, H for hearing. So if you see those symbols, then you'll know that that particular plan offers those options. And we'll look at some of those in here in just a minute. You'll always find that Original Medicare pops up, and this just gives you an average cost of someone that is in Medicare with those particular medications if they enrolled in Medicare today, that it's estimated their total out-of-pocket cost for drug copays would be around $1,252. Of course, their monthly premium typically would be $134. The deductible for everyone is $183 for their Part B deductible. And then it gives you some health benefits, and it can't really give you drug restrictions in general, but it could give you the estimated annual health and drug costs of $8,900. So it kind of gives you a ballpark, and I typically don't share this information with the beneficiary. It's just a good note as a counselor to have that because we don't want to cause them any confusion. What we want to do is go ahead and scroll down to look at the prescription drug plan. So we're going to look at prescription drug plans first, and you can see that we're going to look at the 10, but you can view 20 or you can view all 25 that are available if you want to click that. We'll come back to the compare. With the compare plans, you can select up to 3 different plans and look at them side by side. But we're not going to do that today. We're just going to look at the plan individually so that you start to get familiar with the information that's available. And as you get more savvy with the plan, then you possibly could compare side by side. It automatically sorts the plans by the lowest remainder of the year retail cost, meaning that if someone you counseled today, which is September the 19th, what information we are going to see would actually be their costs from October 1 through December 31 of 2018. We can, didn't mean to click that, but you can sort, but you can sort by other results if someone is interested in star ratings or the lowest monthly premium, or if they are very adamant about a specific plan they want to see, you can go straight to it and sort it alphabetically. If they do not want a drug deductible, then you can sort it that way. Typically, I keep it at the lowest remainder for the year, but I think all the counselors are a little different, and so you just need to develop how you like to do it. So for this particular beneficiary with the 3 medications that we entered into the PlanFinder, SilverScript Choice shows up as the estimated lowest cost. So let's look at that. The pharmacy status, there is a preferred cost sharing, so we can look to see which of the 2 pharmacies, it could be both, are actually a preferred pharmacy. And if they did enroll in the plan today, it would be effective October 1st, and this would be their out-of-pocket cost until the end of the year. And you can see that they'll save about $26 if they did mail order. The monthly premium is $25.40. There is no drug deductible, and the copays range from $3 up to 46%, and we'll look at that in more detail. The good news is that all 3 medications are on this plan's formulary and that there's no drug restrictions. You'll find that that will be different, particularly for this year with pain medication that would fall into the opioid category. You'll see that there are several drug plans and advantage plans that will no longer have those on their formulary, and so you may see a no. One of the neat things about this is if you do have a question, you can click on the yes or no, and it will actually tell you. So the lisinopril is Tier 1, and keep in mind that you probably went over it yesterday. There are about 5 tiers for Medicare drug coverage. Tier 1 is the lowest, typically the lowest cost, and it's a preferred generic, and you can go all the way up to Tier 5. But you can see that the Novolog is Tier 3, but it is a preferred brand, and the Synthroid is a Tier 4, and it's non-preferred. So we're going to see some interesting things. And if there was any restrictions, then it would be over here. So I'm going to close this window. And here is medication management. So you can click on that, and it will share with you that there is, with this plan, medication therapy management, and it's free. And if a member has any questions, they can utilize that. They do have to be a member of the plan to do that. So let's go ahead and look at what SilverScript offers for our beneficiary. So keep in mind, we are looking at prescription drug plans, which are standalone. So there will not be any health benefits like an Advantage plan. So the information you see under this tab will just be general information for a Medicare beneficiary. You can also look at the overview of the prescription. It will give you phone numbers for the member to call or the non-member. It's at 4 out of 5 stars, which that's pretty good. And it will tell you how the stars, what they are looking at on those stars ratings. I typically don't share the overview with a counseling session unless the topic comes up, because it's so much to help them with just the drug cost coverage. So I've clicked on the drug cost and coverage tab, and that's where we're going to focus on the next few minutes. So you'll see that the plan name and the company that runs that plan, and then we'll go down and it will show you the monthly drug plan premium. This should match the monthly premium in the back of their Medicare and You Handbook, which we should be getting 2019 in the mail any day now, as well as your beneficiary. And because this is a standalone drug plan, there's no monthly health plan premiums. It's just not even applicable because they would be considered in original Medicare with a drug plan and not having a Medicare Advantage plan. And with this particular plan, there's no annual drug deductible. So when we selected the 2 pharmacies, here's CVS and Food City. Actually, surprisingly, there's not that big of a cost difference between the 2 pharmacies. And then mail order. So you can scroll on down, and it automatically puts CVS as first. And so let's look at this for CVS, the cost. So you'll see here are the 3 drugs that we typed in, and here is the full cost of the medication. And this is very important to understand because I believe you all probably talked about the donut hole yesterday, and then this is how you would see what the full cost of the drug is and how they would get to the donut hole. This is the frequency of our fill, and we selected once a month. And remember, we could have selected 3 times, every 3 months, etc. So with the initial coverage phase, this would actually be their copay. So lisinopril, very low cost, and remember it was a preferred generic, so their copay is $1.41. With the Novolog, remember it was a preferred brand name, their copay is $42. And even though the Synthroid was non-preferred, their copay is only $16.64. So for many people, that's really not going to be a high copay. But we're going to manipulate the system and show you how it could be much lower for folks. If they were to go into the donut hole, then this is where you would get that information. And then this would be the amount that they would pay during the donut hole. But keep in mind, we're at the end of the year and their medication costs are relatively low, and so this particular person is not going to hit the donut hole. If they did hit the donut hole and work their way through it, when they came out and they were in the catastrophic coverage, then their copay would only be $24.41. The one piece I really love about the PlanFinder is this bar chart. So when you start counseling someone during open enrollment after October 15th and you select, let me go back and see, there will be an opportunity for you to select what year you want to look at, whether it's 2018 or 2019, once open enrollment begins. So if you selected 2019, then you'll actually see all 12 months of the monthly cost for that year. Here is the monthly copay for the medication, but then you see it's $85. What is that amount? So the $60 plus the $25 premium, $25.40, will give you around a number of $85. So each month for the rest of this year, this beneficiary would pay a total of $85 if they only got these medications and they paid that monthly premium. There is a color coding, which is really neat, that you'll see in gray. Here's the premium cost. And then if there was a deductible, it would show you in the bar chart where that deductible would be met in which month. And then the initial coverage is green, and you can see that this beneficiary will be in initial coverage for the rest of the year. If they were in the gap, then you would see some orange up here. And then once they got out of the gap or the donut hole, same thing, then you would see that this would be blue. So before we go any further, let's go back up and let's look at Food City. So you can see they charge a little bit more for lisinopril and a little bit more for Novolog and a little bit more for Synthroid. So if the person has developed a relationship with the pharmacy staff at Food City and does not want to change, $6 more is no big deal, then they can select to go there. And you can see that their copay at $66.69 and their $25.40 monthly premium bumps up to $92. And before we leave, let's look at the mail order. And you can see that with mail order, it looks like it's a requirement for every 3 months. So they would not get their drugs once a month. It would come every 3 months. And then this would be their copay. So the Synthroid becomes $0 copay. The Novolog is at $105, and the Synthroid is at $49.24. For 3 months worth of medicines, it's $154. So you can see that there's a little cost savings there if they select mail order. With the bar chart, what you'll see is they'll get their medicine in October, but it's for 3 months. So they won't get another fill in November and December. So you can see that these are the gray boxes here, and that means that they'll just pay their monthly premium in November and December, and they won't have any copay at the pharmacy for their medication. So one of the things that can help is if there is a discussion on why a drug costs more or less, then once again here are the tiers for you to review, And if there are any restrictions, then you would see it over here to the right. Down at the bottom, it also gives us a little bit more. We can go in and make changes here if we get through this and we're talking and I say, oh, I really take 20 milligrams of lisinopril. You can go in and change that. So you could just change dose. And you could change that to 20 milligrams and update your drug and dosage. So when you do that, then we probably will see just a little difference. And I think, if I remember correctly, that went up 2 cents on the 20 milligram versus the 10. So that is the standalone drug. So they're interested in the Advantage plan as well. So we're going to go back up to the bar under the big blue boxes, and we're going to go back to our plan results. And we're going to scroll down past our prescription drug options until we get to the health plans / Advantage plans. So here we have the health plans with drug coverage we selected, and it compares it the lowest estimated annual drug cost, but you can resort it with the same criteria as we talked about with the prescription drug plan. I'm going to keep it at the lowest estimated annual health plan, and we're going to keep the same pharmacies. So with these pharmacies and these medications, WellCare Dividend, which is an HMO, is showing as the lowest estimated cost. So what we will see here is that the one or both of the pharmacies are in a standard cost sharing, and that if they enrolled in this plan, their total out-of-pocket cost would be $255, and their mail order cost would be $216. Under the monthly premiums, we'll see that there's no monthly premium for their drug coverage, and there's no monthly premium for their health coverage, but they still have to pay that Part B as in boy premium. There is no annual drug deductible nor health plan deductible, and the coinsurance actually ranges from $6 up to 33% of the drug cost. Now, with an Advantage plan, you'll have to remember that the doctors, pharmacies, and skilled nursing facilities, all of those will need to be in network for the beneficiary to get the lowest cost of benefit. So with that, you'll need to help them make sure that their doctor accepts this plan before you enroll them. There is an out-of-pocket spending limit of $6,700 if they are in network, and we'll look at that. Oh, remember we talked about the letters. So here we go. So with this particular plan, it looks like there are some additional dental, vision, and hearing coverage. So we'll be sure to look at that. Once again, the drugs that we selected are on the formulary, so that's good, and that there are no drug restrictions, and that the estimated cost for them, if they went to the doctors and did all that stuff for their health, would be $4,300. It is 3 out of 5 stars. So if that's something important to them, we would want to look at the starring system. So I'm going to select WellCare Dividend for us to look at. And you'll see that the tabs are the same, and it does tell us about the symbols again. So in case you don't quite remember, it should be on the screen for you. And with the overview, it's similar to the standalone drug plan. It will tell you about the stars. And it will also give you an option to go and find Dr. Smith or Dr. Jones or whoever your beneficiary is using to see if they would accept that. But it's always good to encourage the beneficiary to call and double check. So with the health plan, also known as the Advantage Plan, we do want to look at the Health and Drug Plan tab. We want to get some information about this. And so what we can see is that it shares with us there's no monthly health premium, there's no plan deductible, and the maximum out-of-pocket is $6,700. There's no optional supplement benefits, and we'll look at that. So let's look at this cost here. So inpatient hospital coverage, their out-of-pocket copay will be $1,450 per stay. That's not per day. So they'll want to know that when you're talking with them. If they have outpatient, it's $350 per visit. So that will be good to note for their financing when they're looking at the cost of original Medicare versus the cost of the Advantage Plan, and kind of how their health is. If they are frequently in the hospital, then this may not be as cost-effective as original Medicare with a supplement for someone new to Medicare. Doctor visits, $10 per visit is not bad, and specialist is $50. So we mentioned that, well, before we go on, you can expand that list by viewing more details. And here are emergency copays, diagnostic copays, mental health, skilled nursing, and this is interesting. So this particular plan stays similar to original Medicare. Days 1 through 20 are at zero copay, and then for days 21 through 100, it's at $164.50. You can see the ambulance ride will cost them $250, and if they have chemotherapy, then they would have a 20% copay there. So it's lots of information that you can share with your beneficiary as they are looking at Advantage plans. So we mentioned that they had highlighted dental, vision, and hearing. So here is the additional hearing benefits. They'll pay, copay for a hearing exam is $50, and fitting and evaluation is $0. Hearing aids are $0. And you'll want to check on what this limitation is on the hearing aids, whether or not they actually provide the hearing aids or pay a portion. That we don't know from the PlanFinder. So looking at the plan website would be more beneficial there. So with preventive dental, you can see that they can get an oral exam, they can get a cleaning, and that there's some limitations. So it could be that it's once a year or twice a year. If they get fluoride treatment, that's going to be 100% out of their pocket. The Advantage Plan is not going to cover it. And then they can have dental x-rays, but there's some limitations there. So there is a comprehensive dental option here, and let's look. So really, it's not as comprehensive as that tab leads us to believe, because you can see all those items are not covered. However, the periodontics is covered, but it's limited. Extractions. So if someone is really looking and they're wanting dental coverage, this plan may not be the plan for them. We may need to go back and look for a plan that has more coverage, which may be a little bit more expensive for them for the rest of the year. Here's vision. And you can see that it looks like routine is covered, and some contacts and glasses, and there's some limitations on those that they would want to check out for sure. So this is all under the health and drug plan benefits. Now we want to move to the drug costs. And it looks very similar to the standalone drug plan that we looked at. You see that there are monthly premium amounts, and those for this Advantage plan are zero. And then we can see what the cost will be.
But for that Advantage plan, it says that its monthly cost is zero.
Mm-hmm.
So would they have to pay the $134 Part B?
Regardless, even if they enrolled in the Medicare Advantage plan, they had a premium, they would pay that in addition to the $134.
Yes. So the Part B premium is paid for, but there's no monthly premiums for the Advantage plan.
Okay, thank you.
So you can see that with CVS or Food City, the cost is going to be the same, so they don't have to worry about that. And mail order is quite significant on the savings, I would think, for someone on fixed income, so they may want to consider doing mail order, and that's $215. And once again, we have the option to looking at CVS cost versus Food City's cost as well as mail order. So let's just stick with CVS and see what they have for lisinopril. You can see that the full cost of their drugs with this particular plan is a little bit different than the standalone plan, and the total monthly full cost is $331, but what the beneficiary would pay is actually lower. So all three of their meds, if they got them filled per month, their copay would be $85. If by chance they got in the donut hole, also known as the coverage gap, then you'll see what their copays are, and that total would be $116 a month. If they worked through the donut hole or coverage gap and landed in the catastrophic coverage, then they would only be paying that 5% of the full cost of the med, and so it would be $24. So you still have the bar chart, and you'll see that it's $85. Since there are no premiums for the health portion or the drug portion, then that $85 actually matches the drug copay. And the same color coding applies with the drug portion of the Advantage plan as well. You can also see how the Advantage plan has tiered the drugs, and it looks like it is the same as that standalone drug plan.
Shannon, got a question.
Sure.
Back up to the donut hole.
Yes.
Looking at the lisinopril,
Yes.
the initial coverage was $1.63, and if you were in the donut hole, it's about half that. It went down.
See, so this year the beneficiary is going to pay 37% of the cost of the drug.
Okay. That percentage change. Okay.
Yeah. So that's and once it goes to 25%, and I believe that by 2020 I think, then we'll see that both name brand and generics will only be at 25% coverage. So good question.
Thank you.
All right. So I want to go back, and I am going to keep our drug list ID of 037441948 and our password date of 9/19, and I'm going to change the information about our beneficiary. And let's pretend that we had talked with this beneficiary last year, and now they are enrolled in Medicare, and they have original Medicare, and they get help with a Medicare savings program, and we're going to we want to add drugs because I want you to be able to see the details. And now we're going to continue to plan results. So now this beneficiary we've entered some personal information about them, and it's going to show us that they do have a subsidy based on partial benefit dual. And this gives us what that actually means. And that means that this is a person that is enrolled in a Medicare savings program. Now, if the person has QMB, which you guys will learn about next, then you would see a full benefit dual. But this person gets partial, and it's based on their income. And I believe Sydney will be sharing with you more detail. So we kept the same person, and therefore we were able to keep the same drugs. So I'm not going to change anything. We're going to say our drug list is complete. And I'm going to keep the same pharmacies, but keep in mind you can expand it and get all the available pharmacies within that expansion. So I'm not making any pharmacy changes, and we're going to continue to the PlanFinder, or plan results. So once again, because the person is receiving subsidy, they can actually change plans, and I'm going to show you what their cost would be with original Medicare or an Advantage plan. So with the changes in their subsidy, WellCare Classic, and I don't remember if that was the same one or not, but it comes up as the lowest cost. So let's remember that the prescription drug plan cost previously was over $200. Now that they have assistance with their drug costs, their cost for the rest of the year, which would be October, November, and December, is now only $50. Their monthly premium is now at $0 instead of $25. And there is no drug deductible still. And their copays now are $3.35 or $8.35 because of their subsidy. So let's look at how that works in more detail. So remember, we're in the standalone drug plan, so we're only really need to look at the drug cost and coverage. We've already talked with this beneficiary before, so they kind of understand our lingo, and we'll see that because they are receiving subsidy, this standalone drug plan for them is $0 monthly premium, and the plan already was at no deductible, so that didn't change. Now, when they go to the pharmacy, there is little copay, and for the rest of the year, if they went to CVS, it would cost them $50.10. If they went to Food City, it would cost them $54.99. Mail orders only $16. So they do have that option. With CVS, here's the full cost of the drug. So even though the person has subsidy, there's still that dollar amount for the full cost of the drug. However, with the subsidy, now we're looking at, instead of that $1.70-ish copay for lisinopril, it's $0. Novolog has dropped from, what was it, $40 or so to $8.35, as well as their Synthroid. So when they go to the pharmacy, their copay is only going to be $16.70. And this is the pre-initial coverage, and which also mimics the initial coverage period, and I think you guys covered the details of that yesterday, so I won't spend more time going back over that. If they were to get in the donut hole, then you would see that it would only go up a couple of dollars, and when they got into the catastrophic coverage, it would drop to nothing for this particular person. So here's where the color coding can come in. The pre-initial coverage for them is in orange. However, there's no cost change for them, and once they do get into that initial coverage, then it's the same. So I wouldn't even worry them with understanding the difference, just letting them know that their monthly copays will be around $17. So it's a significant cost help for them to be enrolled in either Extra Help or the Medicare Savings Programs. And that's one of the things that you guys will be talking about later today. And once again, here are how the plan has tiered it. So let's go back and look at how the Advantage Plan. So you want to go back to your plan results. And let's scroll down to Advantage Plans and look with, so now with the subsidy, the lowest estimated cost plan is WellCare RX. The cost out of pocket for them for the rest of the year would be $55, and it would be $20 for mail order. And the Part B premium, depending on where they fall in their subsidy, they would not be paying that Part B premium. TennCare would pay that for them. And there would be no monthly premiums for the drug portion or the health portion. And with this plan, there's no drug deductible or health plan deductible. This person would still need to work within the network to maximize their cost savings. If they went out of network, they would have some copays, and so that's something that you would want to talk with the beneficiary about. And their drugs are on the formulary. So let's look at WellCare RX for this beneficiary who is now receiving subsidy. So we want to look at the health and drug plan benefit for them. The premiums and deductibles are at $0, and then they would have inpatient costs $275 for days 1 through 5, and that's what they would need to know so that they could plan. We know they're on a fixed income because they qualify for subsidy, so they'll need to plan for that. Outpatient hospital coverage, the same thing. So we're looking at $150 to $250 per visit. They'll need to plan for that. The good news is there's no copay when they go to their primary care physician, but there is a $40 per visit for any specialist. We can look at more cost copays for them, and we'll see that here's rehab service visits, ambulance is $250, and let's go down to the hearing. So you can look at the plan for hearing, preventative. If dental coverage is very important, you can see that there's some preventative care, and let's look at the comprehensive to see if they get very much more. So yes, they actually get some endodontics and restorative, but it's limited, so they would have to check to see if what they needed is provided. And vision, you can look through there as well and see what is available. Under optional supplements, I didn't cover this under the last review of the Advantage Plan, but there are some Advantage plans that offer some optional supplemental benefits at an additional monthly premium. And one of those that we see under optional supplement is the Silver Sneakers program. It may or may not have an additional monthly premium, but that's probably where you would find that additional piece. And depending on where you are in the state, that Silver Sneaker program seems to be very popular. So let's look quickly at the drug cost coverage. Once again, you will see that there's no premiums, and that if the person wants to go to CVS or Food City, it's same copay. And you will see that it's just going to be, what was that, $1 or $2 more than the standalone prescription drug plan. And let's look at the mail order cost, and you can see that the copay for that would only be $19.70. And once again, with mail order, this particular plan, mail orders every 3 months. So in your bar chart, you would see that $20, which is just rounding up for the $19.76, and they would pay it in October, and then they would not have a drug copay for the rest of the year. Plus, because they're on subsidy and they're not paying a monthly premium, then once they pay that $20 for their drug coverage, they would not have any more drug coverage. Is there anything you want me to add in particular?
No, I think you did a great job. Does anyone have any questions for Shannon?
Let me unmute everybody.
He used it before and
All right. Well, I'll turn it back over to Sydney.
Great. So I'm going to stop the recording here.